Mm. Hello, hi everyone. Hello. If you come in, you can type on the comment so I know you are here. The live will be starting at 9 o'clock sharp. Right? Okay. If you are here already, do help me share this live to your friend. Today we are going to talk about 5 situations for kids or children that if you see, they have to see dentist immediately, right? Best to share to your friend who have kids between 2 to 12 years old. Of course, if they don't have any kids, it's also good to share to them because it's something that's good to know. They can share with their friends, right? So DOC is actually stand for dentist, optometrist, and chiropractor. It's basically four buddies. If you can see from the screen, we have JY, who is the optometrist, myself and Ellen are the dentists, and John is the chiropractor. So we will be doing live every Tuesday at 9 o'clock about different topic about healthcare, right? Whoever just come in, hi, happy new year. I think just now I came back to the clinic to do this live, and on the road is quite busy. I'm not sure all the traffic has been coming back already. Like everybody not really afraid about COVID at the moment, right? If you just came in, please say hi on the chat so I know you are here. Let me see if there's anyone. Okay. By the way, if you all have any question regarding, not necessarily regarding dentistry, if you have any question regarding your eye or your or your back pain, next week we are going to have John the chiropractor to share with us. So if you have any question, you can always comment here, and then we'll make sure that John answer all the question. Okay. Right, I see. DOC is commenting. Okay. Just 1 second. All right, whoever just come in, welcome. Just let me check if it is connected to Facebook already. Right, dentist is a little bit quite stupid with this Facebook thing. Right, so we are on. Let me see. Right. Right, whoever just come in, please say hi on the chat so that I can see you. So how was your New Year this year? Was it a quiet, you stay at home, or you went out for some shopping or had some dinner with your family and friends or girlfriend or boyfriend? Okay, let's see. The sharing will be starting in 5 minutes. If you just come in, do share with your friend, post on Facebook, right? So that they also can get some information about what we are going to share today. So let me see. Today, mainly this is the topic we're going to talk about today. 5 situations your children require dental care as soon as possible. This is going to change the life of the kids like forever. If you don't do that, if you don't bring them to see dentists in these 5 situations, they are probably going to have a lot of dental problem in the future. So okay. So usually in Tuesday, we'll have many people in the clinic, but today the other two are a little bit busy. So today only myself and Ellen, and probably, let me show if I can see you guys. So we have, let me see. We have Ellen here. Can we see? Hello. Do you manage to see or not? We have Ellen and then Kelly. Kelly is our staff. Working very late, working very hard. Let me see. I put this back. All right. Okay, the live will be starting, the sharing will be starting in about 4 minutes. If you just come in, do say hi on the chat so we can know who is here. Right, we see JY. JY is our optometrist. JY will be sharing probably in another 2 weeks. He still haven't come up with a topic yet. So if you have anything that you think you want him as an optometrist to advise, you can type your comment below so we can make sure that he answers all your questions. Don't share it. Ellen is a funny one among 4 of us. The other 4, I think the other 3 is a little bit more serious. Ellen is the funny one. Okay, just let me get this right. If you can comment below, is this the first time you are listening to sharing of our DOC sharing? If this is your first time, do type 1. If your first time here, do type 1 on the comment so that I know who I'm talking to. If you heard our sharing before, type 2. Okay. Hi, Danny. I see you. Hi, Eric. Eric and Danny is in the same BNI group as myself, John, and our optometrist JY. Alan is in another BNI group. So this is how we all 4 of us get together to do this thing. So the reason why we start DOC is that we realize a lot of us, we have some problem with our body, but we don't straight away go look for help. We think that maybe a little bit of back pain or my eyes a little bit blur. We don't need to go and see professional immediately. Hopefully it will go away. That is actually a wrong concept. When you feel abnormal on your body, it's actually your body telling you that you have to seek for professional help as soon as possible. So in order to bridge the gap between you don't want to see a professional yet or until the problem become very bad, we are the gap in between. We hope to raise some awareness so you get a little bit more knowledge on your health so you can go and see a professional when it's required. Hi, Danny. I think JY is more lengthy than me. JY is our optometrist. All right. So it's 9 o'clock now. We are going to start our sharing for today. You know, by doing this live, all of us gain some new skills. So we did a little bit small video for our intro. So we're going to play to start the show. Okay. All right, welcome everybody. This is the DOC Care Live Show. We do live show on every Tuesday, basically for Buddy, which let me see, I can pull that up. Yep. So Basically, there are four of us, myself, Alan, JY, and John, three profession, dentist, chiropractic, and also optometrist. So we mainly here to share healthcare information, useful tips like daily tip that you can do for your everyday use in order to raise some healthcare awareness in the public. So this is what we do. So today our topic is about 5 situations if you see in your kids, you need to bring your kids to see dentist as soon as possible. Because if you leave the problem too long, it might have some serious consequences in the future when they grow up. All right. So one of the concept for kids is when they're young, they have their baby teeth, and all of us know the baby teeth is going to be replaced by adult teeth. So many of us think that, oh, it's going to be replaced anyway, so we don't need to really take care of it, or we don't need to, even if there's some motor just passed by. So even if the teeth broke down, we don't really need to bring them to see dentist and fill up the hole because it's going to be replaced anyway. But actually that's wrong because of a few reasons. The first reason is kids also need to eat, right? So you need your teeth to chew and eat properly. If they have bad teeth, sometimes kids do that. Very common. We found out in our patient. When teeth have bad teeth, they have pain in their teeth and they don't eat well, but they don't tell their parents because they're afraid of going to see dentist. So they just don't eat so much. They lose their appetite. So that is a very good sign. If you see your kids, they are not eating very well, very likely it's because he or she is having problem with their teeth. Okay, so having a good set of teeth throughout the childhood time is very important for their growth because you need to eat well and get the nutrition. And the second reason is the way that the baby teeth is being replaced, there is a sequence. It's quite a complicated sequence, so I don't think it's important to know. But the thing is, there is a sequence. If there's one teeth supposed to be replaced at the age of 9 or 10, but is becoming broken at the age of 5 or 4, and it has to be extracted, the way your adult teeth grow is going to change, and most likely it won't grow in a nice way. So in the future, the kids might need braces. So keeping your baby teeth healthy is actually helping them to be replaced in a nice way so that they have a nicer looking teeth in the future, right? Also, the other thing is when your baby has problem with your teeth, and that means they're not taking good care of their teeth. So this is a habit thing. If a baby or a kid had bad teeth and don't have a proper oral hygiene habit, it means they are not brushing correctly, they are not flossing correctly. In the future, when they have adult teeth, chances are they are also not going to take good care of their teeth. So it's like a habit. It's better to instill the habit when they're young. So when they become adult, they already have the habit of taking good care of their teeth so they don't really regret. All right. So today we're going to share 5 situations of if you see this situation in the baby's teeth, you have to bring them to see dentist immediately. Right. I see more people coming in. Hi, Alice. Hi, Yiling. Hi, JC. JC, we sort of chat a little bit late just now, right? So JC actually asked a few good questions just now in Facebook chat. If you don't mind, do you mind I share the question later towards the end of the sharing? By the way, towards the end we will have Q&A session. We have Q&A session. So if you have any question, can leave it down here. If you have any question that's not related to this topic, also can put it down. If we have time, we will answer all the questions, right? So 5 situations where your kids need dental care as soon as possible. The first situation is what we call the crossbite, right? It's a very technical term, but it basically means when during 5 to 7 years old, that's when your baby front teeth will be replaced by adult teeth. But if you see the lower front teeth is in front of the upper adult front teeth, that is not normal. This is the first situation where your kids need to see dentist as soon as possible. It's a bit technical. I'll repeat again. 5 to 7 years old, front teeth is going to be replaced by adult front teeth. If the correct way of biting is the upper should be in front of the lower. If it's the other way around, you have to bring your kids to see dentist immediately. The reason is our upper jaw and lower jaw grow very, very differently. Our upper jaw is basically like enlarging. Lower jaw will go front. If I go to my side, it will grow this way. So you do see some people when they, especially adult, in Malaysia, it's quite common. You see some people, their bite is like this, right? If it's raining, it's going to catch water. So this is mainly because 5 to 7 years old, when the front teeth grow or replace the baby teeth, it grow the other way. The upper is at the back. So there's nothing to guide the lower jaw growth. So it will just grow and grow and grow and grow and grow to the front. So the consequences of this is, if it grows too much to the front, it's going to affect the bite in the future. So they can't bite properly, and even braces can't help, because braces can move the teeth, but we can't change bone. If it grows too much in front, we can't really fix it by moving just the teeth. So the only alternative to fix that problem is actually surgery. So if you see your kids have this problem, bring them to see dentist as soon as possible. We have ways to sort of correct it. We only need to bring the front teeth to the front, and then chances are the growth of the lower jaw will be nicer. Okay, so this is the first situation where if you see in your kids, you have to bring them to see dentist immediately. If not, he or she going to be having a difficult time when they grow up. All right, so people will just come in. Oh, I see. Hi, Ricky. Ricky is my guitar teacher long time ago. Now he's trying to teach his kids. I think he has a 4 years old kid. Ricky, your kid is 5 years old, is it? So he's teaching his kids drum. All right. So this is the first situation of the 5 situations we're going to share today. The second situation, which is your teeth, the baby's teeth should be replacing left and right at the same time, roughly at the same time. I'll explain what I mean. So if you put a middle line in the middle, so each side you have 5 teeth, like 5 on the upper right, 5 on the upper left, 5 on the lower left, and 5 on the lower right. So this is the baby teeth. Baby should have 20 teeth. So from age 5 to age 12, they are going to be replaced in a sequence. So I don't expect you, of course, the sequence is right here at the chart. If you want the copy, you can look on Google, or I can send this to you. So the baby teeth should be replaced left and right at the similar timing. So for example, if at 5 years old, the lower right first teeth is fallen out, being shaky, fallen out, and replaced by the adult teeth, the lower left first teeth should be replacing within 6 months. So the gap is 6 months. Means if the upper right teeth is replacing, within 6 months, the upper left teeth has to be replaced. So if it's not, there must be something wrong going on inside the bone. So it's either it's being stuck, or the baby doesn't have that tooth. It's very rare, but it do happen. So if it's happened, we have to warn the parents. You have to bring them to a check, and then we have to warn the parents on how to take better care of the teeth. Okay, so this is a situation. Situation 1 is when the lower teeth is in front. Situation 2 is if one side of the teeth is out, the other side is not out, that you should be worried. You should be that we strongly advise you to bring your kids to the dental clinic, probably get an x-ray done to make sure that they have all the teeth, or what, to find out why is it not coming out. All right. William Lim, bring them to see Dr. Billy. So Ricky kid is 7 years old. He just told me that his son is changing teeth now. All right, so this is the second situation. The third situation is very common. I'm not sure is it Malaysia, but it's quite common in our practice, is baby teeth with caries. Caries means cavity. All right, so when baby teeth has caries, like we mentioned just now, baby has to eat as well. Cavity might lead to pain, and then your kids might not want to eat anything, but because they don't want to go to see dentist, so they don't tell you, and then they stop eating. So that is going to affect their growth. So if baby teeth have caries, best is to bring in to get it filled, right? If the caries become bigger and bigger, then we might have to extract it. We might have to remove the teeth, and then the sequence of the adult teeth erupting or coming out is disrupted. So chances are the baby will grow up to adult, and then they will have not so nice teeth, and then they might need braces in the future. So holes or cavity on baby teeth has to be filled up. There's only 1 or 2 reasons that we don't fill out the baby teeth. If let's say we know that the front teeth is going to change between 5 or 7 years old, if we found a cavity on that tooth at around 6 years old, we know that it's going to be replaced. So we might not fill the teeth, right? The second reason why we won't fill a cavity on a baby teeth is we think that the caries is very, very big and the filling won't stay. So probably we will just leave it. All right. So this is the third situation where if you see in your kid's mouth, you have to bring them to see dentist immediately. Okay. Let's see if we have more people coming in. We still have Jasmine. Lucky now looks good. Lucky. Who is Lucky? Who is Lucky? All right. Oh, Yiling is asking, what is the best age to do braces? Let's answer this quick. What is the best age for kids to do braces? There's a lot of theory, but now the theories has changed to the best age is actually around 12 to 13 years old. Unless, like the first situation you mentioned, unless you see there's some abnormal growth that we need to intercept, for example, the lower front teeth at the back, then we will do it before 12 years old. If, let's say, the teeth is coming out okay, 12 years old to 14 years old is actually a good time. Some long time ago, if you go to government clinic, probably they say, oh, you have to wait until 16 years old when all the teeth is out. Now we actually don't believe in that so much because when the teeth just erupted and when the kids are younger, moving the teeth is easier. So the earlier we do braces is actually better or can finish faster. But the only drawback is putting braces is not really an easy journey, right? You have metal in your mouth. So we will talk to the kids. If we see the kids is compliant enough, she's willing to go through the procedure, then we will do braces at around 12 years old. All right. Let's see. So this is the second reason, right? This is the third reason. The first reason is if the first situation where you have to bring your kids to see dentist is when your lower teeth is in front, upper teeth is at the back. So this is a very, very common. If you see that, they have to be fixed as soon as possible. The second reason is if your baby teeth has caries, have cavity, have to be filled out immediately. The third situation, your kids need dental care as soon as possible is during 5 to 7 years old, the kids' first adult teeth, adult molar, adult back teeth will be out, right? How do you know is that is an adult teeth? It's actually the teeth number 6 on each side. So if you see on the picture, see whether I can make it bigger or not. Gosh, I think I messed up a little bit. Right. 1 second, 1 second. There we go. There. So from the middle you count, baby teeth only 5. So 1 to 5 are all baby teeth. The number 6 is the adult big teeth where the baby or anybody, all of us, need that tooth for chewing. It's the big teeth for chewing. But unfortunately, it comes out at the age of 5 to 7 years old, right? And it's right at the back there. So it's very hard to get it clean and get it maintain the hygiene. So if there's caries, there's cavity on the number 6 teeth, you see some black spot, it looks something like this. If you see something like this on the teeth number 6, this is a big sign that telling you that your kids need to do a filling as soon as possible, right? This is very important because this is one of the most important teeth for the kids for the rest of his life. All right. So if you are not sure, whether that is a caries or not, or if there's if that is just a stain, you should bring your kids to see dentists regularly and then get it checked. If we see something, we advise the parents to get it fixed. Okay, right. So there's also another way to prevent this. This is quite common. What we do is healthy teeth. It looks like this is a very typical shape of a molar. So usually they have like a deep part in between, in the middle of the teeth. So that part is the part where all the food and bacteria stay inside and very hard to get out and very hard to brush, and that's usually where it gets cavity. So usually for kids, we see that it's difficult for them to clean. We do something called the fissure sealant. Fissure sealant looks something like this. We basically make the depression or the longgang flatter so the food doesn't get stuck there so easily and the kids can clean easier. So this is a very good way to fix the teeth. All right. So let's see. So those are the 4 things. The first one, as we mentioned, if the adult front teeth come out, lower is in front, upper is at the back, big sign to bring your kids to see dentist. The second reason, second situation, if one side of the teeth is coming out already, the other side is not, that is also a sign that your kids need to see dentist as soon as possible. The third one is when your baby teeth, when your kid's baby teeth has cavity, has to be filled up. Number 4 is when the 6 teeth, which come out at the age of 5 to 7, if there's some black spot, you have to bring them to see dentist immediately, right? So those are the 4 situations. The last situation probably is a little bit unconventional, which is when your baby has no pain, no dental problem at all, but they have not seen a dentist before. That is actually a very good situation to bring them to see dentist. Now, a lot of us, I would say 90%, right? If you are one of them, do type 1 in the comment. 90% of us, we are afraid of seeing dentists. And big part of us is because we had bad experience in dentists. Maybe it's in the school. Remember in primary school time, there'll be nurses coming to the school, and then you have the queue and then the see dentist, and everybody is afraid. So bad experience with the dentist stick with your kids forever, right? So if you wait until there's problem or there's a cavity, only you bring your kids to see the dentist, the first experience cannot be really pleasant because then drilling will be involved. There will be pain. You have to give injection. So that is when they start being afraid of dentists. And probably you're going to be having a difficult time. We are trying to get the kids on the chair and the kids are crying. So it's also good for the parents. So if your kids has no problem at all, but haven't been to any dentist before, it's actually a good time to see dentist. That is a time we can educate the parents how to maintain the good teeth that the kids have, and we can build the bond with the kids and showing the kids, look, seeing dentists is actually not so scary. So they have a very good first impression about seeing dentists. And when they really need to see dentists, you're going to have an easier time as parents to bring them to see dentists. All right. So those are the 5 situations. We think that if you see in your kids, you have to bring them to see dentist immediately. The first, let's do a quick recap before we jump to the question and answer. The first one is adult front teeth, 5 to 7 years old, adult front teeth come out. If lower is in front of the upper, have to see dentist immediately. Second reason, if left side, one side of the teeth is coming out, the other side is not out within 6 months, you have to bring your kids to see dentist immediately, right? The third reason, the kids, if they have a cavity, have to be filled out. Although it's going to be replaced, but it's important to have healthy teeth throughout the whole childhood so that they can eat properly, and also we don't need to remove the teeth sooner than they should be. right? Number 4, teeth number 6, 5 to 7 years old, the first molar, the first big teeth will be coming out. If there's black mark on it, have to bring to see dentist. And number 5 is if your kids haven't been to dentist before and they have no pain, no problem at all, probably is a very good time to bring them to see dentist so that they build up a very good, they have a very good experience and build up a confidence with dentist. So in the future, if they really need to see dentist, they will be more compliant. So you have an easier time as parents. All right. So these are basically the sharing for today. Do we have any question? Let's go through the question, some of the question. All right. We have Yiling. No. Okay. Yiling asks, how to prevent cavity for kids. I think as parents, no, I don't have any kids. But as parents, you probably hope or want your kids to have very healthy teeth. I guess the first thing is dental checkup is very important. Get them used to it, and then brushing, flossing at the age of 7 or 8. If there's any tight place, flossing is very important. You can start flossing already, right? And also the fissure sealant we mentioned just now. Adult teeth or many teeth, they have this longgang thing. That's where the food gets stuck. What is that? Alan is taking photos. So big teeth, when there's longgang, food gets stuck there easily. It's very difficult to clean. So we put a very thin layer. Your kids won't realize it, to seal up the longgang so they can clean properly. And also the other thing is, which I had conversation with one of the lady here, JC. She asked, is fluoride? Some dentists say, oh, every kids need fluoride so that they can have healthy teeth. It's true to a certain extent. Not every kid require fluoride treatment. Of course, if you do, it's good. It's extra protection. Usually in our practice, how do we decide whether a kids need to have extra fluoride or not? Is if we see there's already many cavities in the mouth, so that means this kid has a higher prone to getting cavities, so we'll apply fluoride, right? And the second reason is if we found out that the eating habit of the kids, they like a lot of sweet, a lot of acidic thing like Vitagen, yogurt drink, fruit juice. So if that is the eating habit, fluoride is going to help. So what essentially fluoride do is basically to strengthen your teeth. It prevent your teeth breaking down, right? So in Malaysia, our water and most of the toothpaste has fluoride already. So if we see that the kids need extra fluoride, that's when we will say, okay, let's do it. So how often you should do the fluoride is usually we advise every 6 months for high risk kids at high risk of getting cavities. So every 6 months we'll apply the fluoride. I think most dental clinics do it, so you can get it done in any dentist you go to, right? So that is that. Okay, let's see. Is there any? JC also has Listerine for younger kids like 6 to 10 is okay or not? Right. No. So I think in general, mouthwash is very good for everybody, kids or adult. But there are also different type of mouthwash. There's the very common one is either you have alcohol or don't have alcohol. I think Listerine is one of the brand that has alcohol. So alcohol, I think, but they also have series that doesn't contain alcohol. So mouthwash with alcohol, usually we use it after somebody had surgery. It basically kill everything, the good bacteria, bad bacteria. You see on the label say 99.99% bacteria kill. So it's basically for those purpose. On everyday use, we usually advise adults and kids, both adult and kids, to use mouthwash that doesn't contain alcohol, because alcohol, it causes your mouth to be dry. It reduces your saliva flow, and that would actually increase the risk of getting caries. So if you want them to use mouthwash, choose something that's milder. It's not so, how do you know it's milder? It doesn't contain alcohol, it's not so spicy. So mouthwash can be used at the age of 6 onwards, should be okay to use, but choose something that's more gentle, right? All right. Elaine asks, how often should we bring kids for dental checkup? We would advise 3 months to 6 months, but the 3 months is mainly to get them used to seeing dentists, but they are okay already, and we think that he's maintaining very good oral health. 6 months is very sufficient. All right, but because this is actually also applied to adult. In our practice, we see our patient starting from every 3 months. So every 3 months they come back. If their teeth are very good, then we upgrade them. They become 4 month patient. They come every 4 months. If 4 months they come back, they are also taking very good care. Their teeth is very good. Then we upgrade them to 5 months. This is like car. I don't know why our group like to say car, but if two people buy a car and one person take very good care of the car and the other person don't really take good care of the car, so this person probably need to send for service less. This person who doesn't take good care of the car will probably have to send to service more often. So we can't say everybody should come and see dentist every 6 months, because everybody eat differently. They brush differently. Some don't brush. Some brush one day. Some brush three. Some brush 3 days. Right. So everybody is different. So it varies. We start from 3 months, then we slowly upgrade them. All right. Okay. So do we have any more question? Just let me, while we are waiting for any more question, we can go. So next week we are going to have Dr. Jonathan. He's a chiropractor. He's also my chiropractor. As you know now, MCO, everybody work from home. Even if not working from home, you are sitting in the office long time. So chances are we all have back pain, right? And a lot of the time we think that, oh, back pain is because we are getting old, and we sort of accepted that back pain is actually part of our life, it's normal, but actually it's not, right? So if you have back pain, and most people say it's due to sleep disc. So next week, Tuesday, 9 o'clock, Dr. Jonathan will be sharing with us about back pain. How do you avoid that? What actually causes back pain? Is every back pain going to lead to sleep disc? He's going to talk about that. All right. So just a recap. DOC, we are 4 buddies together. There's 4 of us, 3 profession, dentist, optometrist, and chiropractor. So that's why it's called DOC. We will be doing live every Tuesday at 9 o'clock. So if you have nothing to do and you feel like listening to some podcast or Facebook sharing to get some healthcare knowledge, welcome to tune in. And if you think the sharing is interesting, today can share to your friends so that they also can be benefit from that. All right. So I guess there's not many questions today. So we will see you next Tuesday. All right. Thank you for tuning in. Thank you for all the time. We'll see you next week.